Amid the growing statistics, the government is now setting the stage for stricter restrictions and a possible lockdown of possible neighbourhoods. New guidelines published by the Ministry of Health give the CS express powers to declare any region as an infected zone and isolate its residents. The Gazette notice declares the coronavirus disease a formidable epidemic. Some Gituku reports on the new step that could signal a new phase in the fight against the pandemic.
For days now, the Health CS has been hinting at stricter measures in the coming days as the pandemic worsens in the country. And now the stage may be set for wide-ranging stricter movement restrictions and other drastic measures prescribed in the Public Health Act. In the two Gazette notices, CS Kagwe has declared the COVID-19 what experts call a formidable epidemic disease and a notifiable disease. The declaration allowing the CS to require mandatory speedy burials of people who die from the disease. It also allows the government to lock down specific areas if they are believed to be infected with the virus. Amid concerns that COVID-19 cases may rise dramatically in the coming days and weeks, the gazettement paves the way for the Ministry of Health to establish hospitals and observation stations or camps where infected persons and their contacts can be admitted.
We have asked the county commissioners, the head teachers of the schools involved in boarding facilities. We have asked those involved in the preparation of food in those boarding facilities to start planning. We would like to see, depending on the population of the county, an additional 1,000 bed capacity as quarantine facilities in boarding schools and in hospitals.
Kagwe's regulations now put in black and white the government's power to isolate patients and their contacts. The guidelines will also help in regulating the hospitals involved in handling COVID-19 patients, while also allowing the Cabinet Secretary to declare certain areas infected.
I cannot emphasize more the need for you to prepare yourself not to travel up country going forward.
The declaration of COVID-19 as a notifiable disease now shifts the responsibility of reporting suspected or positive cases of the virus to persons in charge of premises, occupiers of premises, employers, and even heads of households. They will now be required to notify a medical officer of any suspected cases. The medical officer is in turn required to facilitate movement of such suspected patients to the nearest health facility. Any death related to COVID-19 must also be reported to authorities, with premises where such a person had been required to be identified and secured. Occupants of the said premises may either be held in the same premises, or if risk is too high, they may be quarantined elsewhere. Medical officers will, according to the law, be required to search for COVID-19 positive cases and report them. Buildings or premises believed to have been contaminated by the virus would be decontaminated, with a medical officer required to determine how long occupants would have to stay away. With reports showing that up to 25% of persons carrying the virus may show no symptoms and therefore are likely to pass it on without their knowledge, all coronavirus suspected carriers will be required to cooperate with health officials to be tested, and should they test positive, they may be detained in an isolation center. Those that escape from isolation centers risk a penalty of 20,000 shillings in fine or a 2-month jail term, or both. The Ministry of Health projects up to 10,000 cases of COVID-19 by the end of April if current directives are not observed. The latest Gazette notice may be setting the stage for that next phase. Sam Gituku, TV, Nairobi.